Thank you very much to give me the opportunity to talk about hepatocellular carcinoma in Senegal. As you know, hepatocellular carcinoma is the most common primary liver tumor and represent a real public health problem in our country. It is the second leading cause of cancer in men and the third in women, with hepatitis B as a main risk factor. HCC is a tumor with a very poor prognosis, particularly in resource-poor countries. The aim of our study is to describe the characteristics of HCC at Hospital Principal of Dakar. This is a retrospective and descriptive study including all patients hospitalized for HCC in 6 years. The diagnosis of HCC was based on one of the following three criteria: histological evidence of HCC, combination of two morphological aspects of HCC, or morphological criterion associated with an increase in the level of the alpha photoprotein greater than 400 nanogram per milliliter. We included 229 patients with mean age of 47 years. Among them, 33% were under 40 years of age. The male to female ratio was 6.6. Among our patients, some of them reported a chronic carrier of hepatitis B virus in the family or a chronic history of liver disease in a first degree relative, and 10 patients were on treatment with nucleotide analogs. On clinical characteristics at diagnosis, the performance status of HBV was bad in 48% of cases. The clinical signs were dominated by abdominal pain, which was found in 210 patients, and hepatomegaly in 170 cases. Biological tests showed that liver function test was altered in the majority of patients with cirrhosis in 93% of cases, cholestasis, and low prothrombin time. 68% of patients had a value of alpha protein greater than 400 nanogram per milliliter, but 28 patients, 11%, had normal alpha photoprotein level. On imaging, abdominal ultrasound showed nodular lesion of the liver compatible with HCC in 68% of cases, with an average size of the nodular lesion at 6.5 centimeters. An infiltrative form of HCC was found in 19 patients, and abdominal ultrasound didn't find a lesion compatible with HCC in 38 cases. CT scan was also performed and showed lesion compatible with HCC in 88% of cases. The diagnostic strategy for HCC in our patient was based on a high level of alpha photoprotein in 68% of cases associated with abdominal ultrasound, abdominal CT scan, or MRI. For patients with an alpha photoprotein level below 400 nanogram per milliliter, the diagnosis of HCC was based on ultrasound with MRI and or CT scan, a CT scan associated with MRI, or a CT scan alone. The most common cause of HCC was HBV infection. It was found in 69% of patients. However, 21% of patients, in 21% of patients, no risk factor was found. It should be noted that the investigation were not exhaustive in these cases. Childhood classification showed that patients were childhood B in the majority of cases. According to the Benson stage, around 95% of patients were in advanced or terminal stage. A curative treatment was done in 12 patients and a palliative treatment in 7 patients. The other patient had just symptomatic treatment. The outcome was favorable in 6 patients. These results inspired some comments. Senegal is located in the endemic area of HBV with a high prevalence of HCC. A decrease in the incidence is noted in 40 years, but the situation didn't really reflect the reality in our region because of under-medicalization. Many cases are not diagnosed or reported. HCC in Senegal is a disease of young adults with a clear male predominance. Senegal is an area of a high HBV endemicity, and infection occurs at a very young age. The data are similar to the results found in the various studies conducted in sub-Saharan Africa. The diagnosis is done at late stage, and as in the studies reported in sub-Saharan Africa, this late stage is also reflected by imaging. The average tumor size of HCC at diagnostic is greater than in developed countries. And using BCLC staging, around 95% of patients are in advanced or terminal stage in our country, but also in sub-Saharan Africa. This reflects also a lack of screening program for people at risk. Alpha-fetoprotein is also an important element for the diagnosis in our country. It is available in most health facilities, and combined with ultrasound can do the diagnosis in around 70% of cases in Africa. Significant proportion of HCC without risk factor is found in our study, as in sub-Saharan countries. This may reflect the lack of exhaustive etiological investigation due to the lack of resource. In conclusion, HCC is a condition that mainly affects middle-aged adults with a clear predominance among men in Senegal. Diagnosis at advanced stage, and the main risk factor remains HBV infection. The prognosis is very poor, and it is why it is necessary to do prevention by improving awareness of HBV vaccination, screening for chronic HBV infection, and implementation of HCC screening program for patients at risk. Thank you very much.